Not yet.
Hello. We're live. So it's another Wednesday. So in case of the Wednesdays, no, welcome to Quarantine Q&A. Today we have our very special guest, Mac.
Yeah, special. I don't know about special. Just regular. I don't know about special. Just regular person.
But so we're doing our community spotlight.
We're doing great so far.
Spotlight. But excited to have people from Hope and Health because everyone is so great, really. So we're going to talk about, what you do and a lot about COVID and about testing. Let's jump right in, David.
Oh, all right. Well, for anyone that is watching, we will be taking consumer requests. If you have any questions, concerns, comments, fears, dreams, let's hear them. We want to hear from you and also from him. I can't do this. Right. Anyway, so welcome, Matt. I'm very excited to have you here. One of these. So first things first, if you could just tell us a little bit about yourself, your background, where you've been from, what you do. Give us the skinny.
So my name is Mac. I think by my name it says that right there, Mac. But so that's what can I say about myself? I don't know. It's usually a hard question. Born and raised. I was born in New York, and specifically Far Rockaway. But then I lived in Haiti for a little bit until about 7 or 8 years old. So I actually went to school and did a lot of elementary schooling in Haiti, and then came back here. And when I came back here, my parents moved to Florida because my mom couldn't handle the cold. Then I've been here ever since. I've done sporadic, like every summer before. In the beginning, I used to go to Haiti, but now I just go as an adult because it's just fun. And I go to a different beach every summer for COVID.
Very nice.
For COVID. But,
yeah.
But that's pretty much it. I've been in Florida all my life after I came back, and I'm Black.
Tell me more. Expand upon that.
It's probably hard. That one is hard. That one is a secret.
Okay. Well,
so even though I'm Dominican, I will concede to you that there are some nice beaches in Haiti. We can agree on that. If nothing else.
Yeah. If you can get past the media showings of Haiti and you actually go, it is. I mean, you can see your feet. I'm talking about like 200-300 feet yards in the ocean.
Oh, yeah,
it's amazing. Yeah. And zip line. I think we have like one of the longest zip line ever over one of our beaches too.
That can't be me. Wow.
No. Yeah.
There's no way. I'm way too scared of heights for that. But all right, that's awesome. So why did you choose the educational path that you did? Because we know that you're working on your master's. So what are your plans for utilizing that? If you're going to do that, do something different, or if you want to,
Yeah. So a little bit about the Haitian culture too is like they only validate 4, maybe 5 degrees, and that is like. When I say validate, like people only look at these things as like a big thing, right? Like doctor, you're either a doctor, Haitian parents want you to be a lawyer, doctor, engineer, things like that. So growing up, I wanted to go to med school for sure. And I got to FIU and in my undergrad, and I realized I wanted to be more on the preventative side instead of waiting. I mean, of course, there's preventative medicine, but of course, I wanted to be on a part that's actually studying disease trends and actually making sure people don't get these diseases, as opposed to being reactionary a lot of time. That right. Medicine is like people have to go to the doctor, and then it's like, oh, by the way, you have X, Y, and Z. So that's pretty much what made me decide that maybe public health is the sector. I kind of literally stumbled on public health. While I was going through school, I was a lot of crying and stuff. So I actually literally did biomedical engineering as a degree for 3 of the 4 years I was in undergrad until I started interning as a at a place called Hardware. We're literally like where they make like left ventricles and heart parts and stuff.
That's so cool.
Yeah, and I realized I didn't like it either. because it was like a big factory just making stuff, and yeah,
Like
so
a
it's like
kind of thing.
yeah, it's just like while I'm in a factory working, when I want to be seeing people, talking to people, feeling like I have an immediate impact. And so like I said, I stumble on public health. That's pretty much how it happened.
Awesome. Also, Adrian is your biggest fan right now.
Yeah, I see.
I'm gonna put this one up again because it's actually like
here
really
for it.
I see.
Oh.
Awesome.
Thank
Hey,
you.
Jonathan.
So, I mean, you obviously had an extensive background with education, with medical, with dealing with people. So, we all want to know what brought you to Hope and Health.
So it's a combination of me having to move here. I had heard about Hope and Help through a mutual friend when I was still down in South Florida. And so he was like, Hope and Help is good. They are in the front runner for a lot of things. You should definitely link up with them. So I took the bold step while I was still in South Florida to send out my resume, look for the prevention manager, and email them, like the typical looking through and going on the website, finding who the manager is, and sending your resume and calling that person and being annoying. And Adam
works.
Yeah, it worked.
It works.
And it worked.
Yeah.
Adam was like, yeah, I'll give this guy a call. I'll give this guy an interview. And I did a couple of interviews. And of course, my significant other was up here also, my wife, and I was thinking about getting married. So moving up here was just the move. So it was good. I like it so far. It's amazing. Open Up is great. I like the fact that we're working with our hearts, right? I don't want to sound cliche, as opposed to with working with numbers and trying to meet a particular metric. We are really doing things because we care, and so it's a nice home coming from here.
Yeah, absolutely. Sorry, all that banging is my dog trying desperately to get in the room. Like,
It's either my voice is really good or my voice is annoying. One of them.
Oh, great. But your dog is a part of the quarantine Q&As throughout. So, it's either her dogs or my dogs.
Oh, okay.
Yeah. No, it's you just can't stop. It's because what it really is, I think, is they just like they can hear us talking, but it's probably I would want to be in the room too, right? Like we're having some fun, we're laughing, and they're just in there by themselves. Like, really, y'all gonna have this party without me? Like,
Right.
All right, but sorry. Let's get back to this. Let's talk about COVID-19 a little bit. What was it like for you to sort of be on that team of creating all of the guidelines for us, for the office that are keeping us, not only us safe, but also our clients and people that were coming in to get tested, and some of those concerns going in, and how have they changed now that the time has passed? Maybe the numbers are a little bit different, just things like that.
Right. So with COVID-19, it's I was already part of the health and safety committee that Hope and Help has. Another good thing that Hope and Help has done with having different committees. So I was already part of that committee, and of course, I have to also do what we call a practicum for my schooling, and so I took it upon myself to again insert myself in and ask, hey, can I help out with this as somebody who is in the health and safety committee, who wants to do something and who wants to give back, especially around this time. So it's been interesting. I've done everything. I'm up to date with everything COVID, with vaccines. It's both annoying and interesting at the same time. But the number one concern that we have is safety, right? Safety when it comes to the employees, our staff, and safety when it comes to people coming into our facility. So we've had to worry about, making sure we have updated PPEs for our staff, making sure that we can think of anything that seems like it's common sense or we never really gave a thought. We've been putting into the forefront, literally from like touching the doorknob to seating arrangements to we've looked at every single aspect and analyzed them and say, how can we improve them? How can we keep them safe? How can we make them better? What does that mean for people coming in? What does that mean for our employees and our staff, us as colleagues? And yeah, keeping an eye on vaccines. And also, fun story, I was like a supervisor in one of my previous jobs, and I was in charge of health and safety. So I used to do like health and safety meetings with
Of course.
every single. So, yeah, I've done a lot of jobs. I've done a lot of jobs. I think I've done more jobs than anybody at Hope and Help, probably an exaggeration, but I've done like at least 7 jobs before like, and I'll be more than happy to go through them if you guys want. But I've done like 7
we're
different.
gonna talk about them.
So like, yeah, so as a health and safety person, so as a supervisor in any engineering site, you have to have a public safety meeting before you start working on that site. So I used to do those meetings every time, making sure people are not drunk, coming to work drunk, making sure people are wearing the proper PPEs, making sure they're, it's just stuff like that. So that's an interest of mine. It's like that was always on the back burner, but it goes with health and sure, why not?
Yeah, for sure. And then how do you think though that like how have the concerns shifted? You know what I mean? Like since this started, do you feel like maybe, it's not as dire as it was at the start, or is it the same, or just kind of?
So one thing that has not changed is safety and equipment, right? These things have not changed. We worried about safety and equipment from the beginning since Hope and Help had to shut their doors down. Since we had to shut our doors down, I think like March 16th, we've had to worry about safety and equipment. And what's changed though is the fact that we're going from, okay, this is something we can quickly get past, to now how do we learn to live with it and include it in our day-to-day? Because one thing you don't want to get is COVID fatigue, where you no longer think about these things, and then now you're putting yourself or neighbors at risk. So it's more so now, how do we incorporate it in our everyday life to think about it and to make sure we're being safe and we're thinking about proper protocols. And of course, like I said, especially in our field of HIV, dealing with a lot of other comorbidities and other illnesses, and dealing with weaker immune systems for some individuals, we have to think about these things. And now more than ever, it's how do we live with it while being safe.
Yeah, cool. For sure, definitely.
Yeah, so I mean, with all the precautions we put up for COVID and the shutdowns, the national scares, all that. I'm kind of going a little bit off script, but when it comes to social development, when it comes to disease prevention, what are the parallels you see when it comes to COVID and HIV? Because obviously, for Hope and Help, we are HIV focused, but with everything we're doing, we're encompassing all of public health. So with these two things, do you see any parallels as far as the structures, the way things are being handled?
Yeah, there are a lot of parallels, right? So let's look at a funny one, right? You can put things to prevent you from getting COVID, like a mask, right? You can put a condom to prevent you from getting HIV. A lot of things that we think about in terms of like we think about a mode of transmission, making sure that you're staying away from certain things or keeping yourself safe from certain modes of transmission. In terms of like similarities, of course, we see that COVID affects individuals with certain comorbidities, or who affects individuals with certain illnesses. And again, we know that with any virus, right? Because the virus needs a host to survive. HIV, if you have a weaker immune system, you're also more prone. So things like that. There are a lot of similarities, of course, but at the same time, I think that just like with COVID, if you are, cautious about health, and if you think about certain things, and it's not just behavior, but certain things that you make sure you pay attention to, I think you'll be all right. You'll be safe. It's just a matter of like, if you're in public, make sure you're protecting yourself, just like it's like anything else, right? Washing your hands. If you can't use soap and water, because that's preferable, then hand sanitizer above 60%. You always carry that with you. One thing that I was guilty of is when I use, for example, like a tissue or a napkin to wash my hands or to wipe my hands, I would keep it on me. It's something that's so common sense. I would just like put it in my back pocket to use it. Now with COVID, I have to remember, like, all right, even though I wipe my hands with it, I have to throw it out now. It's just, you never know.
I used to like dry it off and then blow my nose. I was like,
you're like, what am I doing?
You're like,
or just touch the doorknob directly after, like bald I'm just like,
So this is what I meant. This is what I meant earlier when I said like some of the things that we don't usually think about, or some of the things that are common sense that we have to bring to the forefront. I think that's a good job that we did at Hope and Help, where we literally sat down and said, okay, every single thing that people can or cannot do, let's think about them. What does that mean for our different phases of going back to work? What does that mean for, clients coming in? Like, for example, something that touched my heart so much is like we had before we opened back up, we had the water fountain. I mean, everyone, right? We missed it, right? Because we wanted to be able to walk around and get a cool cup of water. But we also have to think about that's something that people go to like every time they're thirsty. So touch, kind of staying away from contact,
coffee
stuff.
machine.
Printing machine, like the printer.
Oh yeah.
The printer to literally punch your pen to print, and we imagine how many people punch their pen in a day, or sometimes 3, 4, 5 times a day at the printer to print. So it's things like that that we have to literally sit down and it's the whole team. It's not just me at all. I don't take credit for anything. Dr. Solero, who's great at that too, is like always bringing things up, and we sat down and we're like, okay, so what do we do about these things, and how do we keep them safe, and how do we keep employees safe? So like, yeah, I'm really happy about that and where we are in terms of COVID. And the goal ultimately is to keep it at 0 transmission of COVID cases at Hope and Help. And so far we've done well, except we're exceptional.
Yeah. I'm going to put Adrian's question back up because when I think with your day, well, you guys can read it, but with day-to-day jobs, do you feel that COVID has made an impact on people's adherence to their treatment plans? If so, can you elaborate a bit on how you are seeing that impact?
Yeah, I don't know if you want me to address that now, because I know we're going to talk about my job as an EIS and what that means. But since it's up now, I can kind of touch it up a little bit. Absolutely, absolutely, COVID has impacted people's adherence, because that's one other thing that they have to think about that they necessarily wouldn't, right? So the HIV community has been great in terms of like the medications. Now you can take, sometimes a pill a day and not have to worry about so many other things and live your normal life. Now with COVID, you have to now think about, all right, can I touch this door? I don't know who touched it before me. And so people are losing their jobs. And so all these things impact people's adherence, right? We call them barriers to care. And all these things that, like these new things that exist with COVID, unfortunately, there are barriers to care. And so because people have to worry about that. People have to worry about putting food on the table. People have to worry about, okay, with COVID, what does that mean for me? Can I do something? Can I go to some of the same places I used to go, right? Can I go do yoga, hot yoga with like 50 people in the room? It might be a safe place where, usually you would go there to kind of, ease your mind and relax. But now it's something that you have to think about. And of course, for some, people handle that differently. For some, that might be a mental stumble block for some, and there goes adherence, and there goes a lot of things. So absolutely, so that's why my job is a lot of being friendly, and a lot of getting to know what the person's going through, and a lot of getting to know what can actually help the person get back into care.
Love that.
Trying to find out where this feedback is coming from.
Yeah, I was thinking about the same thing.
No, I don't know. Unless somebody has, sorry, the window open, a Facebook.
Comment below if you hear the feedback. With that being said, so you brought up a great point about your role here at Hope and Help. So as the early intervention specialist, can you expand a little bit more about what that is, what your job title means, what it does, and how, again, when it comes to HIV prevention and how COVID has affected the clients, what changes have you had to make since the start of the job and then post-COVID?
Yeah, so my job is an early intervention service coordinator, or what they call for short EIS. I like to brag and say we have the coolest job at Hope and Help, because we do a lot of we're literally the middleman for every other department, right? That's how I like to think about it. We are the go-to. So if case management are not able to get a client, we serve as the kind of liaison to actually we are charged with going and locating that client. So when I was talking about barriers to care, it's our job to keep in mind what those barriers to care are and to actually help clients, get back into care, right? To help them fix those problems. So we are literally individuals qualified to locate people with HIV in Area 7 and as well as Brevard County. So some of the barriers to care that EIS have to think about and try to find the proper help for, or try to find the other departments that can help, whether it's linkage or whether it's connecting them back to their medical case manager. So like you think about some of the barriers like housing. So whether we have to get in contact with somebody that specializes in HOPWA, which is like housing for people living with HIV, or, whether we have to think about, if it's a domestic abuse situation, connecting them with a center, rape center, whatever the situation may be, just to make sure that that person can continue or get back into care. So of course, the fun part of it too is we also see people at points of entry, meaning that people that are HIV negative, but maybe they are in a serodiscordant relationship, or maybe their partner is HIV positive. We're able to counsel and advise individuals like that as well to make sure that they can stay negative as well. So we have, I like to say, we have certain benefits of not necessarily dealing with one aspect of HIV, but we do targeted testing, referrals, like I mentioned, and connecting with linkages and doing a lot of outreach services and education and a lot of risk reduction counseling. So that's pretty much our job in a nutshell. So we have the freedom of literally going where we want to go to get the person the help that they need, or even locating that person individually, which is fun. Believe it or not, it is fun. When I approached just recently, I had to go to Brevard County and to see a client because they were not responding to their case manager. And when I got there, that client, we had a candid conversation. And again, it was dealing with the previous question that I think Adrian asked. The client was like, I had to move back with my mom. Medication is the last thing on my mind right now. And I slipped back into a position that I did not want to be in terms of like substance use. And it was literally a conversation. Well, we do offer these services. There's substance abuse hotlines or substance use centers that you can go to. And it's literally like a candid conversation that you can have just to find out what's hurting or what you can do to help somebody. And that's awesome. So we're not discussing one aspect of HIV,
right.
which
I mean, really looking at the whole person, which is
absolutely what we call a psychosocial approach. And of course, with the help of medical interventions like PrEP and stuff like that, like I mentioned earlier, for people that need to stay HIV negative, that is things that we also look at. If we need to locate, the linkage coordinator to help them get PrEP, that's things that we do. So it's just fun stuff. If we have to test because we're in a population that we feel like is a priority population, we're like, hey, well, let's just do a pop-up testing right here, right now, and let's get people into care. It's better for you to know your status. I think I saw a quote somewhere that says the only bad status is not knowing, and I thought that was it's
unknown status.
Yeah. Well, while we're on the topic, this is the perfect segue. So we've been, you've been, really in charge of the home testing initiative that we have, and I think that that's been probably really helpful to people that do, that are afraid to go out in public or afraid to go to a clinic or anything, like that. Do you want to kind of comment on about the home testing kits that we do and
similar to our Protect Your O, which are condom delivery kind of department that we have, home testing, the program, it's amazing. Somebody just wrote something.
Yeah, it's about Norm.
Norm.
Norm is a team member, so I'll take it. So though similar to the Protect Your O that we have, where we deliver condoms, the home testing program is amazing in that sense, where it is literally as disconnected or as connected as you want it to be, right? So a person, they want to get tested, all they have to do is to go search Hope and Help, and right there they can see the home testing program under testing and prevention. They can click on the home testing program, fill out a couple of questions that really helps us know who we're dealing with, also where to send the test. And
That's a
once that's done, you go through it. It comes to the prevention manager as well as we get to filter it and send you your stuff within 3 days. Yeah, there you go.
How did he do that? He's right there.
It looks so good.
So like that, it's been amazing. It's something that I think, especially me as a Haitian and as an African American in America, we know firsthand in terms of like stigmatization of HIV. I mean, one of the best things that I see from the home testing program right now is that the demographic that normally walks in our door is not the demographic ordering the home testing program, and I'm happy because that shows us that yes, people are concerned about the scene, but they're still doing their part to know their status, and they're still ordering, right? And so that's important. We started the home testing program just about 2 months or so, and so far we have upwards of like 45 tests that's already been ordered, which is good. If you look at that math, that's almost about 1 test a day, which is good. And I cannot. Yeah, and the thing that we do extra and that I'm extremely proud of, we also do what we call a navigational system, right? So after they get the test, we're not trying to bombard them. We include a lot of information about support groups and everything they need in the home test, and of course we give some like incentives. Sometimes we give a koozie. Sometimes we give like a little stress reliever, like the little V or the little D, stress reliever. And they get it. When they get it, they take the test. In about 2 to 3 days, I then follow up with a call. And that call is not for me to be intrusive, but the call is literally for me to say, hey, this is Mac. This is the person that sent you the package. Sometimes I don't even say anything. I just say, hey, you ordered a package from us. And they're like, who are you? And I say, am I speaking to so and so? They're like, yeah. And then I say, well, it's the Hope and Help package. And they're like, oh yeah, I received it. I took the test already. And then if I see that they're a little somber, then I'll probe a little bit and say, we're here to offer services. We have 3 doctors on staff. This is not the end of the world. If the result is something you want to share, I'm here. I can get you transportation into our facility if needed. We can get you so many help. It's literally, I go into a spiel. But if they seem like, a little bit more confident or excited that they got their results and it's what they were expecting, then of course I back off and say, well, I'm just want to let you know that we're here. We're just a phone call away. If you need us, this is my number. That's the other purpose of me calling you. Now you have a point of contact to Hope and Help. And like I said, home testing program has been amazing in terms of like our response and what we see. The demographic is amazing. I see a lot of 18 to 24, and then I see a lot of 50 to 59, which, like I said, it is, so it is not the demographic that you would expect. And they can put a P.O. box. We've had a couple of P.O. boxes if you don't want people to know your address.
Right.
Yeah.
That's awesome. Yeah. So you did kind of answer.
Yeah, I did Alex Jones. Yeah. So yeah. So of course, some of the information that we provide, it gives a follow-up location you can go, preferably Hope and Help, but we're not biased as long as you get in care if it's a positive result or a reactive result. But of course, we prefer us, and that's why we do the follow-up as well. But you can definitely in the pamphlet that we provide, see our number and call us as well if they want to call.
Right.
I love that. And it's so important that you do those follow-ups afterwards, and you offer them those services, because again, the immediate thought is, I don't want to tell anyone, but if you just say, we have these services available, we can bring you in, it's confidential, we got these doctors, it's immediate like return, and that's the most important thing for the community.
Absolutely. Whether they give me their result or not, I like to throw it out there, because sometimes people need a day or two to process, right? So they they see the follow-up and they're like, okay, this person literally didn't just send me something. They really care. They want to know if I'm okay. And then so maybe they wait a day or two and then they call my extension, I had somebody that said, I'm going to call you back. I'm at dinner. It didn't sound like they were at dinner, but I took it. But guess what? They have a number to call, right? They have a number to call. And so they call me back and they said, everything's okay. I took it from my significant other, blah, blah, blah. But still, like I said, having that phone number that they can call back, or having that initial point of contact of a person and not just a letter or pamphlet that you receive at home, I think goes a long way. And that's one of the things that I'm proud of about the home testing program.
Yeah.
Excellent. Love that. So with that being said, you alluded to this earlier. You are of Haitian descent, and you work well with the African American and Haitian communities. Now I know when it comes to HIV, the Black and African American Haitian community is disproportionately affected by HIV. To be it stigma, be it lack of medical adherence, anything like that. What are some ways that we can do better to help not only our Black and African American communities, but also the Haitian Creole community that we oftentimes it's a language barrier or something like that. So how are some ways that we can really affect change in those communities and get our communities to be healthier?
Right. That's a very good question. I get that question. I've been getting that question for the past 3 to 4 years since I've been in public health and since I've been specifically in HIV, because I'm usually one of the people that are, one of the few that are of Haitian descent. And so I'll tell you this. So the Haitian population, first thing first is representation, right? We have to have somebody that speaks Creole, because one thing about our people is if they don't know something, they are not going to tell you that they don't know. And I think African Americans are the same too. I was watching this documentary, right? I think it was this teaching session that I was a part of, and they showed you like a lot of people would just say yes to a doctor when the doctor starts speaking in terms that they don't understand. So that's why a lot of times I take a lot longer with my patients, even when I'm doing testing. Then I say it one way, and I'll keep going, and I'll say it again, but in a different way, just to see how they respond. If the response is different, if they're shaking their head a lot more than the first time, then you're like, okay, they understand it a little bit better now. Yeah. So that's one of the things that I think is important with our community is first representation, because I think that breaks down that barrier of having to listen to words that you don't understand. It's already a language that you had to learn. The second thing is stigma. After representation, we also have to break down that stigma. I know the Haitian population, through many faults of when HIV first came on the scene with the 4 H's, the way they labeled HIV as like a Haitian disease. And
what
so,
are the 4 H's,
right, so 4 H's are heroin addicts, right? Haitians, homosexuals, and hemophiliacs, people that requires a lot of blood transfusion. So, huh?
Ding, ding, ding.
Right. So with the 4 H's, right. So with the 4 H's, and since they labeled Haitians as one of them, which has now been debunked, Haitians feel some type of way about HIV and associating with Haitians. So you can imagine how ingrained and how deep that stigma is. And then now, after you got to do that work to say, okay, it's not you. Let's just focus on the disease, right? I understand it's associated with Haitians, but let's separate that. Let's just focus on the source, which is the disease itself. Once you do that, now you have to remove the stigma and then also educate the damage that was done. You have to now erase that damage, because from the 80s to today, misconceptions, a lot of things have changed, but their minds are still stuck on Haitian and HIV. So now you have to do the removing the stigma and then now educating the population. So representation, breaking down the stigma, and then the last thing I would say is just testing, right? Testing in that population. But then again, it requires the cyclical aspect of having somebody represented that can break down the stigma, that can do testing in that area, and then it goes back into that cycle.
I love that concept.
Sorry?
I love that secular concept.
Yeah.
We always think, you get in care and that's it. But no, it's, you get into care, it's, continuing to follow up with your doctors and making sure you're always, checking on yourself. And that's oftentimes what our communities don't really understand.
Yeah, and as a Haitian, as a proud Haitian, one of the things that makes me even more comfortable and happy to work in HIV is the fact that I know I'm representing a minority within a minority, right? So a lot of times they look, like we said earlier, we're a whole person, right? It's a whole aspect. We're not just Black, we're also Haitian. But I'm comfortable being in a room where I'm the only Haitian, because I know that if a Haitian recognizes me, it opens that door for a flood of conversation, education, resources that they need. That is I'm okay with providing. And even if I don't know it, I'm okay with calling a case manager, okay with calling another department and saying, I have this person that does not speak proper English, or I have this person that does not understand the terminologies, and I'm here as the middleman, again, not just as an EIS, but as a Haitian person that can literally bridge that gap. One of the first things that being hired at Hope and Help, they told me is like, if you want to focus on that population, you have the ropes to do so. And I thought that was great. It gave me the freedom to focus on that population. And again, across departments, you have case managers who would randomly call me and say, hey, I've had this client for 6 months. Thank God you're here. Now help me with this person. And I will go in there, and initially, remember the stigma I was talking about earlier, when I would go in there, initially they'll be tense, right? Because now there's not just one person in the room.
There's two.
Right. Yeah. And then it's somebody that's not their primary doctor. So it's somebody that probably don't know the whole history of how I was contracted or anything. So they're extra tense. But then I speak Creole, and I recognize that they're Haitian, so I know that's why I'm going in the room. So you see that first letdown, but then they still don't know how judgmental you're going to be, because they're going to be judgmental. And I let everyone know that, like, whoever it is, that feel no reason to help you. I'm not here to be like, I don't like focusing on how you got the virus. It's not important at all in helping eradicate the virus. That's not why I'm here. I'm here to help eliminate the epidemic, HIV epidemic in the United States. That's why my hand's in the mud. And so once I say all of that in Creole, then the whole barrier's down. Now they don't even look at the provider sometimes. They're looking at me. He's talking to me. And so, again, gratifying situation, but it's not about me or the effect that we are doing, that we can do in the community.
Thank you for doing that as well, because we're definitely missing that part of our.
Absolutely.
What? Okay, I'm sorry. What is this thing about the cat that you guys?
I don't know. Maybe it might be a Haitian joke or something. I don't know.
I was like, I have my dogs running around, but I feel like my mic is mute now.
I think it's just, maybe it's the mic just rubbing against your shirt.
Yeah, it probably is.
No, I don't know. It's mic rubbing against your voluptuous chest.
Y'all can't handle this. You're welcome, viewers. This is the Hope and Help alignment. We have these beautiful workers. We're not only
help after dark.
Yeah, this is what we do. We're here. We are community members, just like everyone. And
right.
Yeah. So a lot of the testing, the events that we've done, you've taken like quite an initiative on. Obviously, at Classic, that was a lot of your influence, and also, at churches, which those were some of the most well-attended testing events I think I've ever done. There've been like full lines, like long lines, and they were all great and super successful. So, what do you kind of see for testing events going forward now, of course, with the virus in the community and things like that? And then what would be your ideal testing event if money was not an issue? Like if you had all the money in the world and there was no virus. Now, don't be saying nothing about no private jets.
Yeah, I mean, just what my ideal testing, I don't even know which part I should answer first, but I already have an answer for the second question. I may have to go back to that question. Really? Somebody said they saw a cat in the background for real.
I got a horse.
Unless the cat can fly, it's not behind me.
Y'all seeing flying cats, man.
I got a puppy.
You guys are too funny.
So first, I don't want to take credit for any of the testing numbers that we've gotten. I don't want to take full credit because you need a team, right? You need a triage. But thank you. You need triage. You need other people who are, helping you test, because there's a lot of people. But Hope and Help has had a testing event where we tested 100 people. So that was one of our biggest testing numbers, I think, for Classic, and which we're all proud of that. But again, testing is also to let people know their status. So again, the credit goes back to them, people that want to know their status. But so in terms of like getting, if I had to do the biggest testing event where money was not an issue. How about offering people like a beach house to stay in for 7 days for getting tested? You know,
Okay. Can I go?
you know, like,
Yeah.
because you think about some of the barriers to care. You think about people having to either work too much so they don't have time to, for leisure. You're like, hey, now you can take this leisure on us, right? Enjoy this beach house, all inclusive. Stay in and do whatever you want. Bring a guest. Look at that. Somebody said I'm in.
Yeah,
Right. So, right. Yeah, I saw that. I just didn't want to say who it was. I didn't know. But yeah, just in case. And of course, the other barrier that I can think of is food. So unlimited food, all you can eat buffet. We partner with a buffet company and say anybody that gets tested with us, they can go in there. You know, why not? I think that takes care of that. And then last thing, I would say lodging or transportation. If I think about those barriers to care, I would literally say, you get tested with us, you get to enjoy vacation. You get tested with us, you get to enjoy this free car. You get tested with us, you get to enjoy free food. Right? You said money is not a barrier.
How many times can you test?
Or like a bus pass for a month.
No, you said money is not. You said money is not. I'm not gonna do our clients right.
He's not doing it. He's not doing it little.
No, I'm not doing our clients a disservice by offering them a bus pass when I can offer them a car.
Yeah, I agree.
Right. All right.
The things we most really hear from the clients. So those are great things.
So before we get to this other question, because it's a good question, what about the part about future of events? Because of the virus, what do you think happen differently or has to happen differently because of that?
I think it does have to happen differently, and I think we would take the best approach is to take a piece of everything else that other people has been doing. So if we look at even retail, right? People have to go to stores. And some of the things that retail stores have been doing is they've had glass barriers between the cashier and somebody said, I want unlimited wigs.
Hey, Malik.
Me too.
If that works, that means you get tested. Why not? But yeah. So it like, for example, creating barriers. I think one of the things, or two of the things that we have to think about is barriers from us and for us, and of course for the person getting tested, and ventilation. So as long as you're in a room with that is well ventilated, that has and they have portable ventilation. I see that UCF right before COVID was coming up with this portable ventilation for public health workers that they can carry with them, that you can just put in a room and can literally just suck all the aerosols that needs to go and leave you with good breathing oxygen.
That's cool.
If you can have things like that, if you think about things like that, I think this is going to be the approach. And of course, like I mentioned way before, some of the things that are common sense or some of the things that we never thought of, we just have to bring them to the forefront every single time. Like, for example, keeping a distance, socially distanced. Like, for example, keeping a mask at all times when you're getting tested. And because it's only a finger prick, and some tests are 60 seconds, some tests are 15 minutes. So it's not like the mask wouldn't have to be political at that point. You just put it just for safety, and you'll be fine. So yeah, and like I said,
so thank you for saying it's not political. It's for health safety.
Right.
So do these people's health safety.
It is. You'll just be in a well ventilated room, and of course, with the space. I think eventually, more than ever, it's more of the fear than the using the common sense. So eventually, once the fear has subsided and the common sense take hold, as well as the public safety measures that are coming here to stay, as long as these things, I think the future of testing wouldn't have to change that much. Like I said, just the barrier, mask, and you keep your distance, and you're in a ventilated room. Of course, if all the EIS or testers in the world can have their own ventilation little thing, that would work too.
Yeah, for
Yeah,
it.
I'm just speaking it to the atmosphere just in case we have an angel donor that wants to just send some money, send
Give
some
us some
money our
money.
way. Right. Openhelp.org and just
I mean,
like
and donate.
Yeah.
donate, just a quick donate.
I've been doing this for
While
5
you're at
years,
it.
so should I get $5 for this? Just
No.
not earlier. Never mind.
Okay, so yeah,
Adrian's-
huh? Yeah.
What approach?
So
or
Adrian's
steps-
question. Yeah. Oh, you got it.
Oh no, I thought no. What approach or steps do you take to approach people to get tested when cultural influence deter them? That's a very good question. I think, like I mentioned about representation, I think the first thing you talk about is not the test itself; it's the person. Approaching the person and being relatable is extremely important, and that's one thing that I do a lot. Is I type my approach for who I'm dealing with. If I'm dealing with, I in my previous jobs, I've done physician detailing, where I literally had to go and kind of like educate providers on certain things that has been updated for their CEUs that they didn't think were important, especially HIV and HIV testing and treatment. So I've done that, and I've spoken to providers, and my language, my approach with them is different as someone that studied biomedical sciences in undergrad. But if I'm not speaking to a doctor, if I'm not speaking to a provider, there's no need for me to try to be like, hey, do you want to remove the viral? No, like I don't have to talk about viral load as soon as I test them. Like that's not important. That's something that I do throughout sporadically when I know who I'm dealing with. But the first approach is finding out who the person is. Hey, how are you? My name is so and so. What is going on? Like, what brings you here? I always tell people, if you're sitting in front of me, that's a good thing, number one. And number two, that means that I don't care who you are in your past, you've had sex, and we can talk about that sex. I don't want to talk about the scene specifically because I don't want to be nosy, but we could talk about that sexual encounter and see what we would do different. So once we talk about the sexual encounter and see what we would do differently, what we would keep the same, that breaks down the stigma, or that breaks down the wall a lot. Because I tell people, like, half of the thing you've seen on the page, I've done, right? Or all of them sometimes, right? Depending on what the page says, I've done all of them. So let's talk. Let's be. And I always tell them, like, you cannot surprise me anymore. I've seen.
For real though.
I'm serious. I'm serious. I remember in one of my previous, like in my previous employer, I had somebody that sat in front of me for prep because I was doing a prep navigation at one point, and I was trying to get somebody on prep. They sat in front of me, and I said, how many individuals has you had sex with in the past 12 months? And that person was like, okay, hold on. And they pulled out a black book. I'm like, okay,
Yeah, that's awesome.
let's talk.
I wish I had.
And then they're like, of course, because I did DIS as well. That also helped for, but anyway, so I was like, let's talk. Fine. What's that number? I'll give you 5 minutes to count it all if you need to.
Yeah.
What is it? And so I feel like when people see you like that, they're less tense, they're less worrisome. And then, as like I said, sporadically, you can put education and knowledge throughout. They don't have to feel tense. And the good thing about it is, I always say, you want that individual to leave you better than they came in mentally, and in terms of act, like knowledge-wise. You want them to know a little bit more. If they can go outside and talk to their friend or a stranger about pre-exposure prophylaxis or post-non-PEP or post-exposure, you feel good. So it's not about rushing to get through it, but it's about relating to the person so you can get your point across, and so they can remember the point after they leave you.
Great. Yeah, one of my favorite things to say, actually, and I got this from Tim when he was training me at the center. So Tim, if you're listening, I love you. But no, sometimes people they look kind of nervous at you after you've asked them, well, how many partners have you had in the last 12 months? And they'll get like this, like almost like sad look on their face a little bit. And then I'll just be like, well, I was for 9,999. So as long as you can't beat that, or you, I'd be happy to get another form, and it'll be exciting for me. So you just tell me whatever that number is, and we're gonna put it on the paper.
You just reminded me of something that I usually do as well. So sometimes I give them my body count. to bring down the wall.
No.
And I'm like, listen, you might see me wearing a shirt or a button-up shirt now, but let me give you my body count so you guys can see that. Listen, it's all right. And then that breaks them down. Of course, then we can have a conversation. The other thing I do too, going back to answer that question a little bit more. Say, for example, the three of us go and we're doing a testing event, and I see someone that looks Haitian that probably speaks Creole. I would purposely stop speaking English to you guys and address them in Creole automatically, even without telling the people next to me that. Because what it does is it does two things. The people next to me are looking at me like, what just happened? Did he just start speaking Creole? And that person across the room is like, he just stopped talking to his colleagues to acknowledge me from across the room. And so now let me have a conversation with that person. So sometimes I do that on purpose as well to break the barrier. If I see that they're Haitian, just start speaking Creole to them far away. I tell them about it.
Good job,
I
Alex.
don't know, man. 16 to 17 might not be a good year for me to do that.
I mean, hey, we don't shame, sexist,
No shame whatsoever. Absolutely. So when I tell them my body count, I'm not telling them that I stopped counting after a certain time. I just tell them from when I was counting. But yeah.
So we're coming up to
Adrian's
the
asking
end.
a lot of good questions here.
Adrian's on it,
Adrian is always on it. We miss you.
He left us and then is continuing the work down south.
Right.
So let's hit this question. So regardless of funds, if you had the ability to create a program to help address a need in the community, what would it be?
A need in the community, still relating to HIV, I'm assuming I would focus on two things: housing and the way people ascertain pleasure in this time period, right? So for example, a place to stay is always important. And then the other thing is a way to ascertain pleasure. What do I mean by that? So for example, if somebody finds pleasure in just twiddling their thumb and being on Instagram and social media, that means that I get them a phone. If they usually take pleasure in playing pool, maybe I give them like a pool pass to go play pool. Something that makes them feel good when they're doing it. I would target that, and then I would, of course, target like housing, because these are two things that I feel like are extremely important in our community. So yeah, that to answer your question.
Yeah, like reading, a library card,
a library card, exactly. So it'll be like a needs assessment, right? As they're walking in, to say, so what is it if you needed to do something to get your mind away from the problems of the world, what would you do? I would just lock myself up in a library. Okay, so here's a library card, and that's what you do. But you do that with a lot of community health needs assessment. That's you quizzing me off the top of my head. I was not even thinking. I know, right? He's like, thank you. I'm gonna take that with me. No,
hey, we gotta keep you on your toes.
That's just me thinking. That's just me thinking off the top of my head. But of course, you can flesh out something where if money was not a factor, then you can definitely flesh out something else. But that's what I think are two extremely important things.
Awesome. Well, we're coming to our last cue of the night. Sadly, these are so fun.
I didn't even know it was this last question. The last question already?
Yeah.
Oh, wow.
Yeah. We flew through it. It's been 55 minutes and 51 seconds and counting already. It literally feels like it's been 10 minutes. Like honestly.
Right.
That's good. That's a testament to a good conversation, because you're not like.
Thank you.
So, who is the person that you would most like to have dinner with, alive or dead, if you could? If they were dead.
So I don't know. I would probably. Can it be like one group of people, or does it have to be one person?
I'll let you have a group of people. Yeah, but you have to tell us.
A group of
Is
people.
That 28? Is that part of the form? The number?
If you can't tell, someone gave me this as a gift one time, and I'm a musician, so I'm in love with all things like musically inclined or musically related. So, this is my. David, you've never seen my mouthpiece. This is my mouthpiece.
No. Oh, you still got
What?
it.
Of course.
I sold mine.
I played a tuba, and so
Thank you.
thank you. I appreciate it, Alex Jones.
Oh yes, Sir Alex Jones.
So I would probably sit around with all the genius musical minds that ever lived in terms of like Beethoven, Chopin, Strauss. I would listen, sit down. I think Strauss. Some people say Strauss, but I sit down and talk to these individuals, and I think I don't know. I just understand what they were thinking, like somebody being blind and writing music as good as when they could see, or somebody being deaf and writing good music as if they were not deaf. I mean, that's amazing to me. It's I don't know how they do it, but I'll probably like gather, just literally go into the tombstone of every dead prodigy and wake them up. Have a seat right here. Let's talk. How do I get like you? How do I become, as decent as you? And that ways to understand. But that's probably it. That's just for me. Just the physical side of me. That's pretty much it.
I love it. That's a great answer.
Yeah.
Oh man, well,
You said you were gonna get back to the question of my jobs. I thought you wanted the list.
Okay.
Okay,
Okay. So
you said you wanted to know all the funny jobs at work. I thought you were gonna
I'll give you one more last question, and I want to hear the most embarrassing story that you have from any job you've ever worked.
Yes.
Since you're so gung ho to talk about it. Now
the list. And I'll get back to it because it's important as to why. So I've worked at a company called Cut, right? So like vector marketing. I don't know if you guys ever heard of it. So like you fresh out of high school and you get into like college and you see this little sign that says, if you come work for me, you can make $15 an hour. And this is like 2007. I'm like, oh man, this is amazing. I'm gonna go work for Cutco. But turns out it was, and again, Hope and Help is not bashing Cutco, but turns out it was one of those pyramid schemes kind of.
Oh no.
Yeah. So I had to pay $400. But then again, at that time, I was like, I just want to work. First job, I don't care what you're telling me. $400 so I can make more money. That seems great. And then they had people walking in the training, literally saying, "Oh, hey, so and so, talk to them about your paycheck. How much you got paid last week? Oh, $2,500." And I'm sitting there like, $2,500.
How they get you?
Yeah, and I should have known because during my interview, like my ex-girlfriend that brought me there at the time, she literally came to drop me off, and they're like, "What about you? Do you want to apply?" She's like, "No, I'm going to work." And they're like, "It doesn't matter. Come in." So she interviewed, and instead of thinking like this girl didn't even apply, I was thinking like, "Oh, cool, I get to work with my girl." So like we're good. Aww. But turns out I couldn't even last. It's a legit job, but I just couldn't last. I couldn't last that long, especially being in the Haitian community where literally every door I knocked on, these people were like, "Are you crazy? I can literally buy $60. I can literally buy $60 knives at Walmart." And I had this lady argue with me. I'm like, "You can get this one knife for $3,000." And she's like, "Or I can get 5 knives at Walmart for $60. And I'll still have more money." And I was like, "But they can last you only 6 months." She was like, "All right, even if they can last me 6 months, I can buy 10 of these $60 ones and still have money left over." And I was like, "You know what? I'm not getting anywhere with this." Like,
she's like, "You better get away from my house right now, or I'm gonna show you what happens."
People were giving me the runaround. I was scheduled an appointment, and they'll cancel on me because you have to do a presentation. And I thought it was $15 an hour, but it's like $15 per presentation. But then your manager is like all over you. It's more about it's less about the presentation and more about getting people to buy products. So I was just like, it's not working. I made $115, and after that, somebody bought something for $50, and I made 20%. And that was it. And I was like, I'm out of here.
I'm out.
Yeah. And then I went to Foot Locker, and from Foot Locker was better. And then from Foot Locker, I went to Old Navy. Then I went to Enterprise. I was supervisor there. Then I was teaching English as a reading coach at an elementary school, Citrus Grove Elementary. Shout out to Citrus Grove. Then I was a fraud investigator. I was a fraud investigator. And then
how did you have all these jobs, man?
Long story.
You're
And then
like
I got to
20.
I got a long job. Yeah. Sorry, I took 15 seconds past an hour. So sorry about that.
No, you're good. I'll let you have it. I like the knife story. Yeah, no, I mean, the final note of this will be if someone came to my house selling knives, I would be so mad.
Goodbye.
I still have my knives, by the way.
Does anyone want any?
Are you still sharp?
They are. So the product is actually good. The product is actually good. And even if you find it on the floor, you can literally
selling them.
No.
Tell them. Come on.
You hear this? I should have had it with me.
We can't get you a car for testing, but if you want these knives.
Look, hey. Promoters here helping help.
I forgot. Yeah, you know what? I should do a knife services if you need knives to cut it.
We're looking for the presentation team meeting.
Oh my God, yes, please. All right. Well, on that note.
Adrian said he went to Citrus Grove. That's cool.
That's awesome. That's really fun. That's really cool.
Yeah.
But all right. Well, anyone that wants knives, hit up Mac.
Not no more. Not anymore. You'll get mine. I'll give you one of mine. Because the $400 that I paid, that I paid was to get a set, and so like I kept my set. So I'll give you one of mine.
Well,
yeah, I love
thank you. Thank you for joining us. I had a great. So yeah, we'll see everybody next week. It's going to be another great community spotlight. Have a wonderful night. Wear your masks. Be safe. We love you.
Be safe. Oh, that's right.
I'm trying to end it.
There you go.